Live from 42nd Street, this is the PIX11 Morning News.
As we continue to talk about the weather across the country more over the past week, right? Nearly a third of our nation's population was under some sort of weather advisory due to high temperatures. And we all know how the excessive heat can be dangerous for our health. You know, a lot of times we think about breathing, heart impacts. But did you know it can actually cause back and joint pain to flare up? It's a real problem for many of us, especially people with certain health conditions and our seniors. Let's bring in Dr. Christopher Good, a spine surgeon, with us this morning to talk a little bit more about it. Thank you so much for being with us. Tell us exactly what the correlation is between the heat and then this back and joint pain.
Sure, it might be kind of counterintuitive because so many of us think about cold weather and rainy days for our joint pain. But this goes way beyond just getting a bad sunburn and causing back pain. We know that as the weather gets hot, we have this tendency to be outside more, and really dehydration and sweating can be a major issue. When we're out in the sun, our blood vessels swell, they become leaky, if you will, as we sweat. And so this dehydration can really lead to inflammation in the body. And if you think about these rapid changes in barometric pressure, shifts up and down, changes in the humidity, all of that can actually put our bodies in a chemical or a physiologic state where we're set up for inflammation.
So
and then you start to couple. Oh, sorry, go ahead.
No. If I'm hearing you correctly, the dehydration is definitely a part of it. We talk about this so much when we come into one of these heat emergencies, and we talk about hydrating. Can you help us to understand effective hydrating? I do a lot of exercising outside as an athlete. I'm a big proponent of adding electrolytes to my routine during this time. Help people understand that.
Yeah, I think that my bias really is, to be pushing the water. And I like electrolytes without a lot of artificial sugars and sweeteners, and I really try to go more on the natural side. A lot of stuff also with like coconut water. But the reality is, if we're out in these 80, 90 degree days and we're trying to exercise, we really need to be pushing, not a cup of water, but 8 ounces, 16 ounces of water at a time. Especially if we're doing increased or unusual activities, things that we're not usually doing, kind of the old weekend warrior situation. But if you think about it, a lot of us are also putting ourselves in weird places where we're not really taking care of our bodies, right? Beach towels, bleachers, picnic benches, amusement parks, boats. These are all places where we not only maybe be getting dehydrated, but we're also putting our body in unnatural, unsupported positions. And so that can also be a setup for back pain or back and joint problems.
And so summertime is the time when we all like to get outside, right? It's sunny, it's gorgeous. We've been locked up all winter. What should people keep in mind if they already have chronic pain that they're dealing with?
Well, for sure. I think year round, we should all be staying fit, right? And if you're taking care of yourself every day, then your body's ready to go out and do the things that you want to do. Obviously, sunscreen, prehydration, right? If you're going to be starting a day like this, get up and have 2 8-ounce glasses of water before you even get the day started. We also know that sleep, another big pillar of health, can be affected when it's hot outside and people aren't sleeping well. And so just don't burn the candle at both ends. Make sure that you're out there having a great time, but prehydrate, sunscreen, try and get your sleep, and be in good shape in general so that when you push your body a little too far, it can keep up with you.
You know what? I think you're really touching on something important there. A lot of times, chronic inflammation, we don't think that we're going to clear our pain by sleeping better. But when we take care of ourselves fully with all of those things, the full functional spectrum, we're going to be better off, and not just stretching.
Oh, absolutely. I mean, I think sleep is one of the pillars of health, right? And we think about our exercise, we think about our diet, what we're putting in our bodies. But if you're not sleeping well, you're cutting one leg off the chair and it's going to tip over. And so I think that going into the summer, if you are somebody who's been sleeping, eating reasonably well, taking care of yourself and exercising, then you can get out there and get after it. But the less you take care of yourself in those ways, the more inflammation, the more pain you're going to have. And year after year, it just gets you down more and more. So real plug for kind of general fitness going into the summer, so that not only do you look good out there on the beach with your bathing suit on,
absolutely.
but more importantly, you feel good as you're doing things.
That's right. Dr. Chris Good, thank you so much for being with us this morning to talk the good stuff about how to keep yourself healthy so you don't go down that spiral of inflammation pain. You can also check out his social media at @drgood_good, or listen to his podcast, Get Back to Your Life. Thanks so much for being with us this morning.